Okay. So, hi everybody. This is me, Alexis, and I am here with one of Oren Bar's star patients, Ruth Sikes, and she just wants to tell you her story because she has an interesting one, and you know, it's not just about what we tell you he can do, but you really want to hear from someone who's actually experienced it. So, once again, this is Ruth, and so let me ask you, what was your life like before? You know.
Oh, um, it's really difficult to go back and think about it because it was so horrible. But to put it in a nutshell, from the year 2000 until I first saw Oren in 2017, I suffered from severe chronic pain and disability. I had three surgeries on my cervical spine in 2000, 2005, and 2016. They were brutal. They were difficult to recover from. I was left with chronic radiculopathy, chronic intractable muscle spasms, just the disability and the pain was so bad, I had to leave my career and retire on medical disability in 2006. I took pain medications. I had a 50 microgram fentanyl patch on my body every day. I used up to 30 milligrams of Valium every day to try and control spasms and lots of other medications. So the quality of my life absolutely sucked. I was confused, I was cloudy, I was depressed. I could go on and on, but it was not a pretty picture. And then I, of course, sought lots of help. I had a neurologist that was treating me for many, many years. I thought of everything possible under the sun to do to help me with my pain. I had massage therapy. I had acupuncture. I had dry needling. I went to all kinds of workshops. I did meditation. I became certified as a yoga instructor, hoping yoga would help. You name it, if it was out there, I tried it. Chiropractor I saw, and nothing really alleviated the pain except drugs. But they alleviated everything else that might have been joyful in my life also. So I was very, very, very happy to be referred to Oren in August of 2017 by my neurologist.
So, by the time you got to see Oren, like, where were you actually at? And by the time you got to him, after doing all of that and then seeing him, where were you at?
When I came to see Oren, I was very debilitated because as a result of the last surgery, I had some really awful symptoms in my legs. I had chronic spasm. I had chronic muscle fasciculations. I had very bad neuropathic pain down my legs. It was so disabling. I couldn't sit in a chair for any length of time. I would try and eat sitting on the floor. I also couldn't swallow after that third surgery for 2.5 years. I could not eat solid food. And so it was dismal. So I was at the point, though, intellectually, where I was committed to the idea that I had everything within my body that I needed to heal. I just didn't know how to do it. I didn't know how to use it, but I had weaned myself off of all but one medication. I was no longer on the serious opioids, but I was severely depressed and very, very thin. I weighed about 92 pounds, and I still had pain, but I was determined that going forward, I was going to find a way to heal inside. That's where I was when I got to Oren. I didn't know how things were going to go or what was going to happen, but I was determined to find a way. And that base of resilience that I had in my past was still there. It was just very, 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 very at the time. So that's kind of what it was like.
Yeah, I mean, I remember you were saying that you was in hospice at home for at least.
I was, yes, I went through a very, very serious depression. Because of the eating problems, I was malnourished. I couldn't get all my medications in. So, for example, a lot of my hormone replacement therapy medications I wasn't getting. So everything was out of whack. And I got to the point where I really didn't want to live like that anymore. I was ready to go. And I had to have a stomach tube put in to feed me. I was approved for a hospice, so hospice was caring for me for 6 weeks. I was headed to death. I had no desire to be alive. And so, yeah, things were very bad, very bad.
And so you said, who recommended Oren to you?
My neurologist. And he had treated me since 2003. I was referred to him by my internist for pain treatment. And he carried me all the way through the years of my second and my third surgery and monitored me and helped me through a lot of terrible times, but primarily through medication and some physical therapy from time to time. And when I was steadfastly refusing some new medications he wanted to try for some of my issues, he said, I don't know why I haven't thought of this before, but here's some information about this man named Oren Bar. And I don't know exactly what it is, but I know he has something because he's really helped some of my patients. So maybe you should try him out. And that was it. Thank God, Dr. Mishu had that thought that day, and I wondered, why didn't he? 14 years, and he didn't tell me about Oren Bar.
So when you first met Oren, what did you think?
My very first appointment, when you go in, you have sort of an intake evaluation, and he learns about your history, but he also spent time explaining to me what he does and how he focuses on the autonomic nervous system and how our bodies can so easily become stuck in the fight or flight response. And that the work he did helped readjust the functioning of your autonomic nervous system. And so then he demonstrated, I had, if you can imagine, every muscle in your right leg being totally hard in spasm and in pain. Well, he put me on his table and used his hands. He found a muscle in my quadriceps, and it kind of plucked it almost like a guitar string. It was very, very hard. And he did some work, some movement and use of his hands and different positioning with my body. And he made the muscle release and become soft. And it hadn't been released and soft in months and months and months. And I was amazed. I was so relieved and hopeful, because I left that appointment knowing that when I came back from my first real full appointment, there was some hope that things could change about my body. And it also made me realize that, yeah, my body can heal. He just proved to me that my body has what it takes already to heal. I just haven't been guided down the right path. So I thought he was magic. I mean, I just thought he was a wizard.
Yeah, we kind of hear that a lot sometimes. What did he do? So how long have you've seen Oren?
Well, I started in August of 2017, and I still see Oren regularly, but during that time period of 3 years, there have been stretches where I didn't go at all. There were times when I just slipped back into my old patterns and I gave into distress. Most of this was emotional and had to do with my severe depression. And so I wouldn't go to see Oren. Like when I had my feeding tube in, I wouldn't go to see Oren because I had a feeding tube protruding from my stomach, and I was, and I was embarrassed. I was sick, and so off and on. But every time I went to serious work with Oren, I improved, and it was a step by step by step by step consistent process. Would it help if I described some of the things that happened and kind of?
No, it's just the fact that you saw him and you got better,
right?
Which is what from
right.
going from where you were
yeah.
to now going better, and even if it took. You've been sick for 14 years,
right?
But in 3 years, you're better. And you just came from, I saw pictures of you from hiking in Idaho. Would
yes.
you have ever thought you'd be able to do that
no.
before you saw it?
No.
Or,
no.
yeah. So, and in that instance, like now that you've been through the process and you're so much better from it,
right?
How do you see your future now? Because you went from a point of being, okay, we're ready, to now.
I have gone from no longer wanting to live to being absolutely delighted and excited and enthused about the next 30 years. I am so happy about what's ahead of me. I mean, I'm 68 years young. I just turned 68 years young, and I just got back from hiking 14 miles in one day up in the Grand Tetons, soaking in a hot spring, having the time of my life. I'm planning, I already have 3 other trips planned this year. And next spring, I'm doing another trip out in the Colorado Rockies and to Moab, Utah, and to Taos, New Mexico. I'm going to Alaska. I love my life. Every day is just full of joy. I do dance classes, I walk, I hike along the Chattahoochee River. I'm enjoying my friends. I can eat. Food is like my best friend now. I love cooking with my husband and having, fun times with friends, and living life, being able to experience normal little aches and pains that you might have, but not have them break down your system, just getting everything reorganized so that your body works the way it was meant to work, and it's not going into panic all the time, and getting all of that garbage washed out of your brain. It is so freeing, and it's wonderful. I'm so happy to be alive. I'm so happy to be me. I love being me. I do. I just love being me. And I am so thankful for Oren. I'm just, the work he does, I wish everybody could experience it. Anybody that has any kind of chronic pain issue needs to try Oren Bar, because it's totally changed my life, and it's given me my life back.
Well, thank you. It's so good to hear your story.
You're so welcome.
Sometimes a lot of people who don't experience chronic pain all the time, they have a little bit difficult time understanding the highs, the lows, and how it really changes your life. And so when you hear that, and then hear how your life can go almost a complete 180 from where it was, just because someone took the time to get to know your body a little better and help you, is really a great testament to your body, and once it's in the right hands, that can guide it into the right direction.
Right.
So thank you so much for sharing your story.
You're so very welcome.
And I'm glad that you were able to do it. And next time we'll be doing another video coming up next week. And we haven't decided what it is yet, but it will be interesting. I'll let you know that. So enjoy the rest of your day, and y'all have a great time.
Thank you.